Are you caring for someone with dementia? It can be very challenging and frustrating to care for someone with dementia by, getting them to do even anything. Maybe getting them to take their medications, taking a shower, or just following commands. It could be very challenging. My name is Abby Sakaraya. I'm founder of Cherished Hands Home Health Care Services, and today I'm going to be talking about ways to care for someone with dementia. Number one, be empathetic and passionate and be patient. We have to put ourselves in the shoe of someone living with dementia because everything we're trying to tell them is not everything that they are comprehending. So if we are patient by putting instruction into smaller blocks, that could help them to follow instruction if we are more patient and empathetic. Number two, be focused and present. What does that mean is if when you are caring for someone with dementia, you have to give them your full attention and you have to be there in a moment because if you leave in a minute or two, they could even go and turn on the stove or do something else that will, hurt themselves. And I remember we had one of our caregivers was with the client and the client was sitting on the toilet and she went back to the room to pick up toilet paper. Before she comes back, the client get up and because they didn't know what else to do. And there was bowel movement everywhere, which creates, a little bit of more work for the caregiver and also, even discomfort for the client themselves. So it's very important to be there in a moment when caring for someone with dementia. Number three, build a relationship and establish trust. What does that mean? For somebody who has dementia, they may not remember you, they may not remember your name, but there's something called emotional memory. They will remember how you make them feel. Research have shown this on over and over again. For instance, if you look like someone who have done something bad to someone with dementia before, they could try to attack you when they see you. But if you have built a relationship with them by caring for them, by smiling, be friendly, when they see you as a friend. So you will have a better chance of getting them to do what you're asking them to do. In my experience as a clinician, I've used it so many times. I always smile with my clients. I make them feel comfortable. So when they see me as friend. They even if they see me from somebody who I've remind them of something good. So then we can be able to carry on with our day without having any issues. And that way I could get them to do anything I want them to do. Number four, establish routine. So it is very important for somebody living with dementia to have a structure and routine. So for instance, if they know that when they wake up in the morning, the first thing they do is go into the bathroom. If they do this over and over again, it becomes a routine. And then there is no struggle to get them to do it. But if there is no routine, even for bathroom, going to the bathroom, somebody could create a bathroom routine. Maybe it's every 2 to 3 hours. They know that they get up and go to the bathroom. And having them in the same environment also helps with the routine and getting them to be compliant with care. For someone with dementia, number five, we have to provide simple and clear instructions. We have to break information into like smaller pieces. For example, this is your pants. We're going to put on your pants. I need you to put your leg here. When they do the first leg, then you ask them to do the second leg. Not like giving them so much information at the same time. This get them overwhelmed and it could result in them not being able to do what we're asking them to do. For instance, in our agency, we use something called like picture cards. So it has on one side, it has the picture on the other side, it has the written words. So we can show them the picture of going to the bathroom, like, okay, I want you going to go to the bathroom. And these also help because it's visual also for them to be able to comply, to get them to do what we're asking them to do. Number 6, you have to safety proof your home. Someone with dementia, half of the time, they don't remember the implication of their actions, especially when they get to the advanced stage of the disease. So we want to make sure that there is no chemicals. And also their medication is locked up in a cabinet where they cannot have access to it. We want to make sure that the stove is turned off and they don't have access to go turn it on. Even when we're giving them a shower, please don't leave them by themselves in the tub because they could hurt themselves if they are alone. So we have to safety proof the house to make sure that they are safe, and we can continue to provide that safe care in a calm environment. In a future video, we're going to talk about how to keep your loved ones safe at home and prevent falls. Number 7, don't argue. With the emotional memory that I mentioned earlier in the video, when you are asking someone with dementia to do something and they said, no, I don't want to do it, just stop right there and take a break. It could even be 2 minutes, and come back and ask them to do the same thing in a nice way. They would do it. However, if you stay on and keep arguing with them, now they remember that that particular activity, they don't want to do it. So it's very important to know when to stop, take a break, even if it's 5 minutes, and come back and try again. This is what we teach in our agency to care for someone with dementia, because as a clinician myself, I've tried it and I know it works. Number 8, we could leverage technology in caring for someone with dementia. For instance, in our agency, we have someone who will only listen to her husband. So what we did is we record the husband's voice on the phone of the caregiver with their permission. And when we want her to take a shower, we're going to play the voice note, and she will actually think her husband is talking to her. So we have one video for each task that we do in the home, like where the husband will say, please take your medication now. So that way it helps a lot. So this is what we've done with some of our other clients as well. So that is why in our agency we go into in-depth assessment to identify better way to care for someone living with dementia. Number 9, promote their independence. So for someone living with dementia, we have to promote their independence by allowing them to do whatever they can still do for themselves. In as little as it might be, we want them to continue to be part of their care as much as possible. If they love to just fold clothes, even if they will not do it well, if you have to redo it again, we let them do it. When you're giving them a shower, if the only thing they could follow instruction to do is wash their face, we want them to do it, because the longer they care for themselves by doing whatever they can, the better we can promote their independence and dignity. Number 10, get support. I understand caring for someone with dementia could be overwhelming for their loved ones. So this is why you need to get an agency or someone who is trained in managing someone with dementia. You don't have to hire us, but you definitely have to seek support from an agency who has specialized in dementia care like us. To learn more about how to care for someone with dementia or schedule a free in-home care assessment, go to cherishedhands.net.